Students, today we are going to study tranquilizer. What is mean by tranquilizer? Tranquilizers, it is a term, major tranquilizer, minor tranquilizer. Tranquilizer, these are the central nervous system depression drugs. Before dealing with the tranquilizer, we are going to study some terms involved in this tranquilizer and diseases condition in which these tranquilizers are used. In first case of disease, it is a psychosis. It is a mental condition characterized by disturbances in mental function. Psychosis, and this psychosis, it is again having two types: organic psychosis and functional psychosis. Organic psychosis, where there is a memory disturbances, clouding of consciousness, they may be due to the endocrinal abnormality or head injury. Organic psychosis, it is a condition in which it is a mental condition. See, the psychosis, it is a mental condition which is characterized by disturbances in mental function. The mental function is get disturbed due to the memory disturbances or clouding of consciousness, and it is due to the endocrinal abnormality or head injury. Head injury is maybe due to the accident. Second one is the functional psychosis. Functional psychosis again having four types. It is manic, schizophrenia, hallucination and anxiety. In manic condition, there is a depressive psychosis or disturbances of mood. It is mood get swings, and sometimes it is angry, sometimes it is laughing, sometimes it is calm. The mood get changes. It is in manic condition, and it is a depressive psychosis. Mainly depression get occurred where the mood get changed. Schizophrenia, it is a second condition of functional psychosis in which there is a disorder of thoughts, emotions, motor behavior, perception, etc. Schizophrenia and manic, it is a mania and schizophrenia, it is a totally different. See, in manic condition there is a no motor activity. In schizophrenia, it is a motor activity shown by the patient. Schizophrenia, in which the disorders of thought disturbance, emotional disturbances, motor behavior and perception, wrong perceptions, wrong meaning, wrong misunderstanding, which may give rise to a overthinking, thoughts and emotions, which shows the motor activity or motor behavior. Motor behavior is first, which is observed as aggressive behavior. Then motor means what? It is a functional. Motor, it is activity which is shown by your hands and lips, means upper limbs or lower limbs. It is a motor activity. It is shown by the patient. Third one is a hallucination. There is a patient observed the cloudiness, mainly cloudiness in the mind, and which is observed by clouding of consciousness in the hallucination. Anxiety, where there is a feeling of fear or apprehension, sometimes which feel that every time these patients feel the fear of do something, that is called as anxiety. The drugs which are used to treat the psychosis or psychiatric disorders are called as psychotropic drugs. These drugs may be classified as first, antipsychotic or neuroleptic or major tranquilizer, antidepressant or thymoleptics, anti-anxiety or anxiolytics or minor tranquilizer. Antipsychotics or neuroleptics or major tranquilizer. Second, antidepressant or thymoleptics, and third one is anti-anxiety or anxiolytics or minor tranquilizer. Today we are going to study the major tranquilizer. Classification of major tranquilizer is: first one is phenothiazine derivative and related tricyclic compound. Phenothiazine derivatives again get having two types: phenothiazine derivative, chlorpromazine, prochlorperazine, trifluoroperazine. B. Thioxanthine derivative, example is chlorprothiazine, flupenthiazole. Phenothiazine, it is a three ring structures in which it is a phenothiazine nucleus. Two benzene rings are attached with nitrogen and sulfur containing 6-membered ring. That is a phenothiazine. Its example is chlorpromazine, prochlorperazine, trifluoroperazine. Thioxanthines. Thioxanthine derivative, where is the two benzene ring which are attached with a six membered ring which is containing oxygen, that is a thioxanthines. Example is chlorphothiazine and flupenthiazole. Second category is butyrophenones. Example is haloperidone, trifluoperidone. Third one is dibenzodiazepine. Example is clozapine. Fourth one is benzamides and salicylamides. Example is sulpiride. Fifth is diphenylbutylpiperidine derivative. Example is pumozide. Miscellaneous compound examples are reserpine, olanzapine, coshapine, and lurazidone. This is all about tranquilizer, types of the diseases involved in this, where the tranquilizer, major tranquilizer, minor drugs, which are used in psychiatric disorders, and the classification of these major tranquilizer. Thank you.